Okay, and then one last housekeeping is we want to thank Hannah Murphy, who is over on the side that we haven't recognized that's doing the illustration for today's session. Feel free to review what we've got going on. Uh, uh, Cassana Sexton, the videographer. We will make sure that we follow up. If you check our website, we'll make sure that we have information on all of our presenters, any videos or anything they wanted to include. And then we always try and have some kind of a video that captures all the information that was shared today. So,
All right, well, thanks everybody for joining us today. I know it's really bright. My name is Nate Wade. I'm an Associate Vice President and in the Office of the Chief Operating Officer at ASU, also a Research Assistant Professor in the College of Health Solutions. Have been working with the Doing Research in Indigenous Communities Conference since the pandemic. And unfortunately, Dr. Molina, John Molina, who is going to be here today, he had an emergency that called him away. And so he's not able to join us, but we really put this panel together to speak about how we started our journey. We started this during the pandemic with Dr. Molina, with Jacob, with our Doing Research in Indigenous Communities Conference, as well as our Reimagining Indigenous Healthcare due to COVID-19 Summit. And then from there, that laid a roadmap for us here at ASU to think about where we wanted to go and really focus on reimagining Indigenous health. And so at that point, I really wanted to thank Dr. Molina for all of his work that he's done with us, from educational webinars to this conference in particular. He just helped us with an Indigenous health training course for cultural awareness. He's coming to give us advice as we move forward in his new capacity, in his new role as the director of, sorry, it's a longer title, Arizona Advisory Council on Indian Healthcare. And so just wanted to give that shout out before we get started. But it's my honor and privilege to be here with Jacob, Angela, and Agnes, who I've had the pleasure of working with for the past 4 years on our Doing Research in Indigenous Communities Conference. And so I'm going to ask them to introduce themselves, and we'll get started.
Hello? Okay. So good afternoon. I'm Agnes Sadikai, and I'm the director of the Circle of Indigenous Empowerment with the Sonoran Center for Excellence in Disabilities, located in Family and Community Medicine, College of Medicine, University of Arizona. So I've been working at the University of Arizona for about 25 years. Started out as a health educator, and then working in the College of Public Health, recruiting students in the health professions, and then switching over and working in disability studies now. So I'm Dana Navajo, and I grew up in a small community called Tisto, Arizona. Actually started at the University of Arizona back in 1988, going there for as a first-year undergraduate student, and eventually graduating with a bachelor's in political science, and then a master's in public administration. So that's who I am. So.
Is this on? Yeah. Good afternoon, everyone. I'm Angela Gonzales. I'm a professor here at ASU. I'm also the director of American Indian Studies here. I'm a sociologist by training, but a lot of the work that I do has to do with Native health, primarily community engaged, community embedded research. I'm really happy to be on this panel to kind of share a little bit about our journey and the impacts of COVID in terms of I think it was a bit of a game changer in multiple ways, but I think it also kind of created opportunities for partnerships with the university. And so very excited to be here. I'm a member of the Hopi tribe from northeastern Arizona, Second Mesa, village of Shamopavi. Yeah, I already said I'm a sociologist by training. Came to ASU, I think it was in 2016. And I tell people when they ask me, do you have any regrets going to ASU? Because I was at Cornell University at the time. And I always tell them, quite honestly, my biggest regret in coming to ASU was that it took me so long. And I say that because I think that this event that we're here today and kind of the partnerships that we have with our sister institutions to the north and the south, it's such a unique environment to be able to have these types of gatherings, to have a critical mass of Indigenous educators and students and researchers and others. I feel so privileged really kind of every day, well, maybe not every day, but many days, because of the environment in which we can do this work and the engagement opportunities that we have with tribal communities. So very glad that all of you decided to stay in the room despite the fact that the food has gone, although I heard that it went very early. I was lucky. I literally got one of the last 2 tamales, so I'm very happy about that.
This is how we're going to remember this drink conference.
It was the tamale session. So you've heard from me already, but just a little more in terms of introduction is, again, my name is Jacob Moore, Vice President, Special Advisor on American Indian Affairs, which I've only been in this role since July of last year. Well, I say since, it seems like it's went by pretty fast, but prior to that, I was the Associate Vice President of Tribal Relations in the Office of Government and Community Engagement for about 9 years. Dr. Brayboy was the special advisor prior to my taking that role. He since went on to Northwestern to be a dean, in education. The predecessor before that was, or the previous was Diane Hamitua, who's now a federal district court judge here in the state of Arizona. And the first person to be in the special advisor role was Dr. Peterson Zaw, former president and chairman of the Navajo Nation. I am a citizen of the Thanatam Nation, but my mother's from Montana, and her mother was from Cheyenne River in South Dakota. So Lakota, Dakota on my mother's side, and then on my dad's side, both Gila River and Thanatam, so Akimetatam and Thanatam on my dad's side. But I grew up in Sells, which is south, of here. All my field trips in elementary school and junior high were to Tucson, to Reed Park and the Sonoran Desert Museum. And so I still have an affinity to Tucson regardless of the rivalry. It's a house divided, but education united. So I always appreciate the work that we get to do together. So again, I'll stop there, but thank you.
Great. So I'm going to just ask questions and we'll go down the line and we can switch it up, whoever feels comfortable answering first. So how did the pandemic shape tribal communities' trust in university-based health research, and what experiences during the pandemic increased or decreased their willingness to engage in future research partnerships, specifically with universities?
I do think, as I said, I think in some ways the pandemic, it magnified so many things. I mean, it magnified, the healthcare crisis on tribal lands for sure. It magnified, and made visible in just glaring ways, the already existent disparities in Native health life expectancy on so many different levels. But I also think, and I say this, from somebody within the university, it also kind of created an opportunity where we talk a lot about, what universities can do to kind of serve Native communities, and not always what Native communities can do for us, because I'm sure many of us are familiar with kind of the helicopter model of research. We have a great idea, we kind of, fly in, we extract knowledge, and then we leave, and then we never, come back. And I think that what the pandemic did is it created a context for really thinking about these partnerships, and for universities to serve tribal communities in ways that I don't know that we ever necessarily had done before. I think it also created opportunities. I think about this in terms of opportunities for students. I think it, in many ways, it kind of helped them to see needs within their own communities, and ways that they can engage in the moment. At the time, I had a study that was looking at Native youth political engagement. And as we all, of course, moved to an online environment through learning, work, and other things, I was able to see where young Native students were there kind of teaching, their relatives, their parents, their grandparents, how to Zoom. And so I think it kind of created a new context for thinking about how we engage, not just between universities and tribal communities, but how we engage within these spaces. Certainly you know, those of us in the university, many of us continue to feel very comfortable in the Zoom environment, but I think it also did the same within tribal communities. So I see it as there's both the positive and negative, but I think, you know, related to the negative in terms of amplifying those disparities, I think it made them difficult to ignore on a national level. So in that regard, I think that the pandemic kind of has been a bit of a turning point for how we think about Native health and how we, as university researchers or administrators, engage with tribal communities and advocate for them within our institutions.
So this is Agnes. So I think to add to what Angela said, you know, during the pandemic, you know, as universities, we had people volunteer. So we had a lot of folks volunteer and provide support just because they saw that the need was out there. And so actually I was part of a group of folks through our Native office under Karen Francis Begay to help compile and deliver PPE to tribal communities. And so we actually engaged a lot of our community members and students who wanted to do something, but yet they were far away because they could not go home. To do and volunteer in their communities. So we saw this spirit of helping, a spirit of mutual aid that developed in communities by students, but also by staff and faculty at the University of Arizona. That was one thing I saw. Another thing I saw in terms of research, we saw then all of us became experts in epidemiology. We start using terms, you know, about outbreaks and R factors. And so people really started thinking about this field of epidemiology and what does it mean? Science and disease investigations and outbreaks. And it really spurred, as Angela said, a lot of our young people to consider public health as a career. So we saw a resurgence of our young Native people going into the public health field because of that. And actually a number of our students went into epidemiology at the master's and the PhD level because they saw that there was, one, a need for epidemiologists, because we found that in our tribal communities there were very, very few epidemiologists. So they went into that field as a call for action. In addition, also in terms of research itself, is that we saw how good that research can be and can be a benefit in such a fast-paced environment. I mean, we saw during those couple of years, we saw how the pandemic started, the outbreaks, people getting sick, but then we saw how fast that we can get a vaccine out. And we saw that vaccines are a benefit to folks because there was always that hesitancy to get vaccinated, but because it was such a novel virus and a lot of people were dying, and then they did fast-pace the process of actually going through the regulations. They went through the actual regulations, but it was fast-paced. And then they piloted the vaccines and they found that it was very effective. And so people saw that benefit. So that was another thing, is they saw that the clinical benefits of research and seeing it in a different light was also another aspect and that universities were able to see. And I think also in terms of positioning university dollars to look at projects that would focus on vaccine hesitancy and how we can engage in communities was also another thing. Some more dollars were passed on to investigators, but also to communities to look at these types of questions that we had. And then also, I would say at the tribal level, we saw more emphasis on strengthening a public health infrastructure in tribal communities. We saw that need. And I think a couple more questions are regarding that, and so I'll defer to Jacob to answer.
Yes, and I think that's kind of where I'm going to struggle too, because there's so much more to add. But I know we got more questions, but I think part of it also in terms of the question of how did the pandemic impact our institutions when it comes to research is that I agree that prior to the pandemic, people didn't know what epidemiology was for the most part, and then even public health was underfunded. And so in some ways, the system itself, not public health just in tribal communities, but counties and state, were always kind of neglected when it came to budgets and funding for public health. And so I think with what, public health providers had, certainly we're able to jump into action because the fact of the matter is that the COVID was really, I'm trying to think of the right word, but really devastating, to tribal nations and communities in terms of the loss of lives and the number of people that, got sick, or the loss of elders, our wisdom keepers as a result of dying from COVID, and even the impact on our students in terms of they were on break, they were on spring break. A lot of them that came from rural communities, and basically they were told don't come back, but we expected them to stay in school. So this idea of kind of a bright light on this lack of infrastructure that had always been there, whether it was broadband or healthcare delivery or food systems or even basic access to water, good drinking water. And we're still doing some of that work up in Navajo Nation right now in terms of water stations that had started then, but work that we're still doing today. I guess the only one, interestingly, I think the one point that I would make is that the Thanatham Nation, for example, donated $1 million to both University of Arizona and to ASU for vaccine research and for, testing, because this was prior to the, an actual vaccine. I mean, we all, kind of take for granted that there was a vaccine, but at the time there wasn't. There was testing, and even testing was still kind of not quite, there yet. And so, when we always really don't want the tribes to have to pay for what we do, but when they do, it was somewhat, unique in that we had a tribe giving money to the universities because they were concerned about not just themselves, but for the greater good of the state, in putting money into vaccine research and also for testing. And then the last thing on testing that I think really helped us, from a research side or even how we deliver healthcare, is that we were doing, the saliva test through Arizona State and making that available throughout communities, but you had to log in and register, and then get in your car and go sit in line, to get tested. And there was, again, through the wastewater epidemiology, the recognition that there was this outbreak, happening in the township of Guadalupe. And so our epidemiologists worked with the city of Tempe and the township of Guadalupe to make testing available. And to their credit, they said that doesn't work. It's 105 degrees out, and we have 10 people living in a household, and you're asking them to log in and register and then get in a car and go sit in line to be tested. And so fortunately they had prima doris, one that had just retired, that they reactivated, and we made the test kits available, and they went door to door to administer the tests, and also gave educational information in terms of how do you isolate an individual who tested positive when you have 7 people living in the same household. So it really helped us think about how we deliver healthcare. The funding that we got through the Thanatham Nation, some obviously some was directly toward testing, but we also really distributed grants out to the idea of hesitancy, is what we were seeing, and we all saw was this lack of information or lack of understanding or even just inaccessibility for underserved populations, including tribal communities. So really interesting work around how do you market, how do you make people feel more comfortable, but also how do we recognize that not everybody has access to the same resources that we might have in city of Tempe or city of Scottsdale, how you deliver that and how you educate. I thought we did some really good deep dive in really making sure that those communities were being served.
I think also to add to that in terms of education, we also ended up having to go into a virtual environment, and so providing support to our Native students who didn't come back during spring break, and the fact that a lot of our classes had to go online pretty quickly, so we jumped right into a virtual environment. And so what we found out is of course, that a lot of our students didn't have access to the internet. That was a big thing, and people were surprised. And it's like, how come they don't have access? Well, the communities in rural communities never had access. And so, you know, a lot of monies were placed through the University of Arizona to provide hotspots to our students and to laptops as well for students who didn't have access to it. And so I spent my time driving up into different communities delivering hotspots to students so that they can access their classes online. And also, we ended up having to advocate for a lot of students who wanted to take a break because this is the time when their families were facing COVID and isolating and facing sickness and so forth, and expecting them to take classes and expect them to, you know, to study and to take exams. I mean, that was a huge disconnect, and so we advocated for our students that, well, you know, they should be given a leave of absence. And classes were also graded on pass-fail to acknowledge that challenge that students faced. But also we saw that for research that also went into a virtual environment. We saw in our earlier panel that the IRB, you know, now goes, for the Navajo Nation IRB, now goes, uses Zoom now. So a lot of our research protocols, research studies had to go virtual too. So that was another aspect, that virtual became a way of communicating, whether it's educating, whether it's doing research and outreach. So that was the era when the beginning of an era that we're now in now.
Thank you. So what role do universities play in addressing health equity, innovation, and policy for tribal communities, especially in the post-pandemic era? And how can universities better align their health research priorities with the needs of tribal communities?
So as I had stated, you know, that we are now in an era where we use a lot of technology to conduct research. So looking at how we do our informed consents now, that we can do them virtually. We can do translations by Zoom as well. So we're looking at a way to where research now, we have to innovate and find new ways to communicate research, but also looking at how we train our next generation of researchers. Looking at what the pandemic has taught us is that we have young people who are interested in a variety of different fields, but really looking at how a pandemic has really impacted their lives, but really looking at stories of communities and seeing the long-term impacts of COVID-19 on communities. And so from personal experience, I would have to say that during the time of COVID, everything, you know, all of our families were instructed to isolate. They kept themselves pretty well during the time. But once a vaccine was coming down the line and people who were expected to be vaccinated during the holiday season, people went home. And then that's when a lot of our elders started getting sick. And in the time span of a month before the vaccines were supposed to be rolled out in February is when, in my family, every week someone was getting sick, a lot of our elders. So anybody over 55. So one by one, I lost at least 13 aunts and uncles and grandparents during that time frame of that whole year when the vaccines were being rolled out. And with that, we lost a lot of wisdom. We lost the people that kept us close. And so looking at that whole year and the impact it has now, we have students who are, and people and communities facing mental health, trauma, and grief. And so that's one thing that we need to look at is ways that pandemics and crisis impact our families. How is that impacting the way that we address any kind of issue? And so grief and trauma. And unfortunately, in our history of American Indian communities, grief and trauma has been a consistent event in our communities, along with infections. We started off with, smallpox and Spanish flu, hantavirus, H1N1, so now we have COVID. And so we really need to think about these cycles of infection and disease and the long-term impacts that it has on our communities. So I think we really need to think about, what research topics we want to focus on and how we can address those. But also, research has mostly been focused, especially in public health, has researched mostly in, chronic disease and illnesses and the negative impacts. But we also need to look at what are things that we did well that was really good during the pandemic. And we see that during, for tribal communities, we had a better response system because our system was, the sort of the bureaucratic system we had in place really helped us in able to distribute vaccines and get people activated. Our CHRs, or community health representatives and outreach workers, were key. But also looking how it's also invigorated and renewed our interest in culture and education, how people homeschool now. So we've seen an increase in parents and communities and guardians looking at homeschooling because they saw the value of education and culture as key to education. So we need to think about those things and document and see how that is sort of like the impacts that have changed our way of living due to COVID. So I'll pass it on.
Just a real quick comment. I think for those of us who kind of know the ASU charter pretty much, by memory, one of the words that always kind of jumps out to me that kind of connects to this is this idea of use-inspired research. I think that, one of the ways that we in the university are starting to and can definitely lean harder into is really kind of focusing on not just use-inspired research, but tribally driven research. To have those relationships, those partnerships, so that the research that we do is not necessarily being driven by us as the university researcher because we have access to a particular grant or there's something that is in our area of expertise, but really trying to develop those relationships early on and being truly equitable partners from the very beginning, sitting around the table together and really listening to what tribal communities, what they see as their research needs, what are their greatest health concerns, not just in terms of driving the research, but also in terms of developing the interventions. It always kind of strikes me, I teach a course on community-based participatory action research, and I remember when I first came across this, this idea, this concept when I was a graduate student, it kind of struck me as, but this is what we've kind of always done. We just didn't really have the language for it. And so I use that as an example because I think that there are certain ways that we relate to each other as Native people, how we relate within community and even outside of community, that I think really helps to inform. It doesn't have to be CBPR, but I think that this idea of having, research partnerships that are really built on authentic relationships, not just kind of extractive. And I do think that, not just ASU and the U of A, but I think a lot of universities are definitely recognizing that. I also think that, this focus on not just knowledge for the sake of knowledge, but really, how does this benefit the community? And that's one of the things that I really appreciated about the previous panel on IRBs is being one of those researchers that kind of gets a little bit frustrated with having to go through the tribal IRB process. I'm trying to kind of shift my mindset in terms of I get to go through the tribal IRB process because it's an opportunity for me to enact sovereignty for my community, for whatever community that I happen to be working with. So I haven't quite made that pivot in thinking, but I'm working on it. But I say that because I think it's important to really kind of think about, making sure, and I do think that universities are doing a much better job at this, as, research should always be conducted in partnership. It should always be done in relationship. Whether it's a relationship to an individual person who is agreeing to be interviewed or a relationship to an entire community, I think that kind of shift to really align on the relationships, I think has been one of kind of the effects perhaps of the pandemic that I think we're starting to value within the institution, in addition to the need and a commitment to developing capacity. It's really wonderful to see so many research projects now where it's not just we will hire, tribal employees to collect data for us, but this idea of really kind of training and developing capacity within communities, I think, is another thing that we can do within the university to make sure that it's not just project focus, but it's really forward thinking in terms of developing an overall capacity within tribal communities to be able to engage in the research and drive the research in many ways.
I do want to, I'll get to the question, but also, I came through the government affairs side. So when you watch those Sunday morning shows, they acknowledge the question and they talk about what they want to talk about and don't talk about the question. But the one that I did want to throw in there that was really kind of, oftentimes when we think about tribal communities, and I think I even touched on that this morning in the opening remarks, is this idea of deficit-based versus strengths-based, because oftentimes we forget about the strengths that we have within our communities, or they get overlooked, in part because, some of the statistics are so devastating, but, really in observing what was happening in tribal government and having been there in the early stages of, was really coming out of the 9/11, there was this funding available for national security and emergency preparedness, and tribes benefited from those funding sources for the creation of Turks, or tribal emergency response commissions. So every tribe had some degree of an emergency response commission, and those were activated, fully during the pandemic. And when you really look at what tribes, how they responded versus to other county or state entities, is that they were apolitical in their response, and shutdowns occurred, regardless of what that meant to, economic sustainability. Arizona was one of those states that barely shut down, compared to California, other places, and obviously there were probably a loss of life as a result of that. But San Carlos or Navajo Nation or others, they were locked down, and no tribal leader, got thrown out of office, as a result of the kinds of practices they had to put in place to protect their community, because people understood, that their lives were on the line, our lives were on the line. And so it was really interesting to kind of see how ready, tribes were. Again, obviously there was still loss of life, but there was really no question about, from a tribal government perspective, that how important it was to take control to the degree that they can. So there's a lesson to be learned there, I think, in terms of how we think about future work and working with tribes. And I also agree with what's already been stated around, what are the tribal priorities and how do we fit in, versus from higher ed, it's typically the other way around, where you've got a grant or you've got a good idea and you've got funded, and now you're looking for a community to, you've got a solution, you're looking for a problem, so you come in with this idea of, well, you're convenient, you got this small population, you'd be a really good study, for my research. And it's like, we kind of have to flip that model, and I think we've done more of that as a result of what's come out of the pandemic. The other thing I would just add is that we did a lot of grant writing during that time, because it became evident to us within Arizona State, as an institution, that we didn't have a lot of strengths as U of A did in terms of having both a medical school and a school of public health, and the work that Agnes is able to do there. We have College of Health Solutions, we have nursing, we have Watts College, which has social work, but for the most part, we were able to do PPE, but somewhat limited on the public health side. And we had epidemiologists, but they were kind of within different units. And so we really, spent a lot of time trying to find resources. And obviously, RADx, funding was out there and available, and taking advantage of some of those programs through NIH. But it became evident that we needed to go find additional funding if we were going to really have an impact in helping to address these issues in our tribal communities. And so Nate, Angela, myself, Dr. Brayboy, uh, Michelle Villegas Gold, Dr. Doblin, spent probably too much time together, working on proposals and responding to what kind of funding opportunities. And I remember teasing Dr. Doblin is a physician by training, and I don't know that I didn't pick up on that. But I was with, on these Zoom calls with these PhDs, and we had a doctor, and I was teasing Brian. I said, "Oh, we got a real doctor, helping us out." So I'm just glad I wasn't in the same room with Dr. Brayboy because he was offended by it. But thematically, what we started to really kind of develop around these concepts in terms of trying to convince philanthropy or potential funders was typically when you're working with a tribal community, or any grant, is that this idea of, well, we're going to build a plane while we fly it. We've got this initiative and we'll get started. But really, I think what's common in tribal communities is that you have to first build a runway before you can fly the plane. And so for our donors, potential donors, we wanted to be clear about expectations, is that it's going to take 6 months or 9 months before we can even gain the trust of the community or really fully understand what are their priorities before we can even get into what we think is a proposed scope of work. But that might change once we really get into the work, because it's going to depend on what the community is looking for or what their specific needs are, because we think we know, but until we ask, then do we really know? And so I think that really helped us think about how we engage in the work, is that, and it goes back to what was already discussed, was this idea of sovereignty and tribal priorities, and coming in humbly, not kind of presenting ourselves as the experts, but really trying to understand how we can be helpful, and also letting our potential funders know that this is how it works in Indian country. So thank you.
If I could just add something to that, this idea of working with kind of like non-traditional research sources, like outside of NIH, NSF, I think that some of the work that Jacob and myself and Nate did was really engage with foundations. Here at ASU, we had the ASU Foundation, and we were part of a project called a Moonshot Accelerator, really trying to kind of go after large dollars. But I mention this because I think for those of us who are university researchers in the room, I know for myself, it was a real eye-opener. I have been chasing federal dollars to do research projects, but what I have discovered, and in part through one of the grants that we have right now with the Genentech Foundation, is that it allows us to do, I think, what many of us want to do, and that's to address systemic changes. Oftentimes NIH or NSF, it's kind of more of a problem-based approach. What is the problem that you're trying to solve? But working with foundations, the way that they do grant writing is just so different. I mean, I don't know that we've ever been asked for a specific aim on any of the foundation proposals that we've submitted, but it has given us the latitude to be able to do work that addresses more institutional change, to create kind of cohorts of individuals, both faculty and students, who are interested in ideas and really think about how do we really move the needle in a big way, versus just looking at reducing rates of cervical cancer, which is still important work, having done that work. But it's very exciting to kind of be in this space now and to kind of see all of these different additional sources of funding to be able to really make these structural changes that I think that we're trying to do here at ASU, and I'm sure that U of A and other places are doing the same thing.
Great. So my next question is, talk about the importance of cultural sensitivity, cultural awareness, cultural humility in research, and then the role, often challenging role, of being an Indigenous faculty, staff, or administrator, and having to train non-Indigenous faculty in research in those practices.
Yeah, I think being in this role as a special advisor, I have great colleagues to work with across, the state and even across the country. It's somewhat of a phenomena in terms of, having special advisors or VPs and others that are filling these roles of really acknowledging sovereignty by higher education, and being direct partners and recognizing tribal sovereignty. And so working with my colleagues, I think Karen Francis Begay, who was in the role prior at University of Arizona, I was telling her, kind of early on, is that it feels like we spend as much time, protecting tribal communities from universities than promoting universities, because coming from these communities and fortunately to have been a liaison, I mean, government affairs for Salt River, as I was on the other side of the table with universities that were kind of knocking on our door and wanted to do research with the tribe, and ASU being one of them because it's so close, that it was somewhat convenient to say, can we do a research project with you? And so, I sometimes kind of have to switch hats in terms of, yes, I'm here on behalf of the university, but let me put on my tribal hat because I'm going to tell you what the tribe's going to tell you or what you should be thinking about. And it is really important to know that there is this cultural dissonance, that, and I get to learn all these big words on the university side, like phenomenological research, is how do you remove your bias or the lens in terms of where you come from when you're working in another community. Because when you don't do that, then you wonder why you weren't successful working with communities. And so it's really an opportunity for us to be able to find that, not necessarily middle ground, their ground, in terms of where you're working, but also how you translate your work in what you're trying to accomplish by way of research that may have very different expectations, whether it's from a funder like a NIH, but also your expectations in terms of publication or that really kind of publish or perish, and you have certain responsibilities as a researcher, to do your scholarly work. But how do you do that in a way that also is respectful of the cultures and the communities with which you're working with? I don't know that I have a good answer for that question because it's a lot of work. But the fact that we're talking about it, I think, is really important. So, but I think the other two have better answers.
Okay. Um, so let me see. So as I stated earlier, my first job was as a health educator working at the Arizona Cancer Center. And so when I was hired, I was to work with particularly tribal communities about cancer, what it is, because at that time, back in the 90s, we had high rates of breast and cervical cancer among some tribal communities, and they're wondering why that's happening. So my job was to educate folks about, something that's more biological, but most of the questions they had were, is there something in the environment that's causing some of these challenges? And so I had to balance all of the concerns and add them to the presentations and educations and trainings I did. And so that was my charge to work. But the Cancer Center, on the other hand, thought that my charge was to enroll American Indians into clinical trials, because that is the charge of a cancer center, to look at clinical trials. And so we are always at odds about what my role would be. And so I was pretty adamant that I would not enroll people in clinical trials or talk about it unless we need to educate from the very beginning, about cancer and address those concerns. Because you're actually trying to recruit people into a research project without even actually letting them know and addressing the concerns in their community. And so after two different cancer center directors, we finally got one that understood, because he grew up near a tribal community up in the Midwest area. So he understood the concerns, and so he actively worked with me to develop a cancer patient navigation program at the Arizona Cancer Center. And so I ended up being the volunteer person who helped and visited cancer patients who were undergoing treatment And physicians would come to me and say, well, my patient is non-compliant. They're not adhering to treatments, and blaming the patient. And then when I'm talking to the person undergoing treatment, would find out they didn't understand what was happening to them. They didn't know that they needed to be staying there because they needed what is called transfusions or chemotherapy. They had to do radiation. They had to be there every single day, and they couldn't understand why that was their treatment protocol. And so I end up having to do a lot of translating of information to communities, because the way that doctors were trained is that this is the way you tell patient that this is what it is, and they should understand and gladly follow your advice. But we know that that's not true. So that was when we started thinking about, we're really looking at respecting patients' wishes, and really talking to physicians and researchers about respecting people. Not so much cultural competency, because they kept saying, well, can you tell us and teach us about working with American Indian tribes or tribes so we can get them into research projects? Like, no, that's not what we're doing. You have to understand we have 22 here in Arizona, federally recognized tribes that cover a fourth of the community, and they have to navigate a very complex system when accessing health care. And then when you add cancer treatment on top of that, that adds more complexity. So really being humble to the process that a person has to navigate. Can you imagine this person coming from a really rural community to a cancer center, being told that they have to go through treatment and be here every single day, and yet they don't have a place to stay, and they have little kids, and they have a job that now they can't go to their job, and how are they going to pay for this? So it was more of teaching folks at the cancer center about that and being humble to the process. That was one thing, that was my role. And actually, I still continue to do that role, because we get more researchers, more people turn over at universities, you get new heads of departments, and the process continues every time. A new VP comes in and says, I want to start working with American Indian communities. And it's like, okay, let's go back to what we did before. And so I think that's what universities, unfortunately, there's a lot of turnover in leadership at times, and we have new strategic plans and new focus areas of research. And some of us, like staff and folks that have been there for a while, have to continually educate people coming in, and be sort of like the liaisons for tribal communities, and provide our personal perspectives on how it impacts our communities. And so even now in my new role, I still get asked the same questions. So how do we recruit more students into the health professions? How do we have this new research project, we need American Indian input, and so it's like, okay, got to go back, look at tribal communities, what they want to work. You have to start having conversations. You have to start listening. So it's a continual process of redoing this over and over and over again. And so that's being just, I think being humble and respectful of working with tribal communities is just one aspect of the job I do, I guess.
What you were describing about over and over again, I was thinking about, isn't that the definition of insanity or something? Yeah. But it's true. I think that, I appreciate the fact that we've kind of shifted away from this idea of cultural competency, which was always a term that I really had a real issue with, because I've been a Hopi tribal member my entire life, and I still don't feel competent in my own culture. And so the idea that somehow, somebody could take so many, credit hours or attend so many workshops and somehow walk away, with a certificate of cultural competency, I always found a little bit offensive. And so I like that the discussion has shifted much more, and the framing of it is around cultural humility, but also cultural awareness. What I like so much about the last term, though, around cultural awareness, it's not only researchers being aware of the culture of the communities, the indigenous communities that they're working with, but they need to be aware of their own culture. And so this idea of, this was not a thing when I was a graduate student. I was always kind of cautioned against the bias that I would bring. And I love now that we're talking about positionality, because I think that these discussions around positionality allow us, and especially allow the students that we're training, to recognize that that's a strength, kind of to this strength point. It is a type of perspective that informs, and you don't have to leave your identity, your experiences, and all of those things at the door. One has to always be aware, but I think that, there's definitely, over the decades, have been some really important shifts, and the fact that we talk about culture not as something that necessarily just belongs to other people, but something that we're all embedded in. And so when I have the non-native colleague who is interested in, learning about Native culture, I try and shift that, twist it a little bit in terms of, I want to learn about your culture first, because I need to know where you're coming from. And so, taking those small opportunities, even though it is over and over and over again, and you do feel like you're beating your head against the wall, it is important to, I think, for those of us who are in positions to educate, whether it's in the classroom or as colleagues, to try and take those opportunities, but also to recognize, not everything has to necessarily be a teaching moment. It does get a little bit exhausting. Yeah, and I know I've seen Jacob in these workshops. I can't even remember the name of the workshops, and I think, what work it is to do that, with each new group of faculty or graduate students. It's I don't know if it's a labor of love, maybe it's a requirement, but it's important work that I know that I see my colleagues engaged in.
Just to add to that, when they say that you are supposed to be unbiased in science, and Western science tell you, Native researchers, we are biased, and that's just the fact, because the way that we do research is we have a lot of values that we place in there. We are responsible for our communities. We work with relatives, so we have to acknowledge relationality in that. We also have to be, reciprocity is also another thing, because we have to give back to the community. Because in our teachings, when you are learning, you give an item to the person out of respect for giving you that knowledge. And if that is not there, then, as one of our panelists said, that knowledge wasn't meant for you. So we run, I guess we would say that we have different value systems and ways of doing research, and people are acknowledging that and writing about that, and students are now have a greater understanding of what that means, because there was a lot of conflict with, well, I would say there's still some conflict with students when they want to go into research, and they have these concerns. I want to go back to my community and do research, but I have all these different concerns. And so looking at those values of reciprocity, of reflecting, and being respectful. You're working in your own community, so many times we have a greater responsibility than someone who comes in who has that, does not have that connection. That's what leads to that helicopter research coming in and going out, because they do not have that connection. Well, our students, our researchers have that connection. They stay in their communities and they work in their communities. And I think that's the shift is now we're seeing more of our tribal communities having their own epicenters and research centers, because they see that that we have more expertise coming home, and the value of developing research projects from their own communities, instead of researchers coming in and saying, we want to do this intervention, we didn't want to do intervention in diabetes and substance abuse, but those interventions are all Western based, when you're trying to promote milk to people who are lactose intolerant, or, saying you need to eat 5 fruits and vegetables when there's no vegetables and fruit to be had, but not looking at traditional foods and how people kept healthy. Looking back at some of the ways that our communities were healthy, and looking at that and renewing that and documenting that and saying this is practice-based evidence, very similar to evidence-based practice.
Great, thank you. Getting back to the grants from foundations and allowing flexibility, we were actually able to build out an Indigenous health cultural awareness training module, and Jessica Hogan, Jesse Soliom, Dr. Molina, who is going to be on this panel, helped build that out, and it's free and available to the public. So we'll put that in our resources that we send out. We're at time already, but just quickly, what excites you about the work to come?
I actually am really excited to see some of the students that I have worked with now have their PhDs and are now at universities. So I get to see them as colleagues. I could call upon them, and really so proud as an auntie to see these kids grow up and advocate. And they come from a different perspective in a generation where they see the amount, I guess, the benefits and all the support versus us from a previous generation who really didn't have that. But, seeing them blossom, I think, is one of the, I'm so hopeful and grateful that we're able to see these students now become professionals and mentoring and training another generation of folks.
I think for me, I'm excited about the fact that we have traction and now it's time to gain momentum. It took a long time to kind of build the traction that I think that we see in universities and the research that so many people are engaged with, and now it's really time to let's build the momentum. I think that there's so many opportunities for that, and so that's what excites me. It also excites me to kind of be in the position that am in at a place like ASU to really try and develop create those structural changes to create programs and curricula that really help to address, that's rigorous, but is also relevant to tribal communities. And so that's what excites me.
I think and I agree with really the perspective on students, and there's another phenomena, which is that for many years, this idea of first generation, and it's still first generation for some families, a lot of families, but the fact of the matter is that there are families that are second and third generation college going, and getting their degrees and working in their professions, which is really excites me to know, and that's within my own family. My father going to school here in the early 60s, when the Center for Indian Ed was first started, when there was no more than 10 students at ASU, Native students. My mother going here in the 80s and getting her degree in social work, and then myself, in the 90s and getting my degree in business, which is kind of interesting when you follow this phenomena of another trend was education being important to tribal communities during that phase, and then social work being important, and then not only business but law, kind of follow that. And so as we see more professionals in our communities that also have that opportunity to give back to the institution and help support the work and have that political clout, I remind our tribal leaders and our alumni is that they have more influence on President Crow than I have. I'm a special advisor, but they're going to listen to you. The leadership of the institutions will listen to you as a stakeholder and take that into consideration more than just an advisor or somebody that works within the institution. And the last thing I would say is that the fact that we have a student segment to this event tomorrow in La Briola, and they're very serious about how they want to have this conversation amongst themselves and how they gain support in terms of their own journey, is that these kinds of resources weren't available when we were going to school. And I know that they appreciate it, but we also want to expand that horizon for them to know that they belong here, and that they can be successful.
Thank you all very much. If you enjoyed this conversation, we will be hosting next year a national conference on Indigenous health equity, policy, and innovation. So we'll encourage you to join us. We'll also be launching an Indigenous Health Leadership Academy. So if you're interested in that aspect, that's another way to get involved with our team and our colleagues.